Hello, my name is Carla Moore. I'm a third year professional pharmacy student from Dallas, Texas. And I did my journal club on a randomized controlled trial of 3 milligrams of liraglutide in weight management. As you see, if you're following along, you'll see my citations have been listed, the authors of the article, the funding, the impact factor, and let me read a little bit of the background for you. Obesity is a chronic disease and a significant global health challenge. Comorbidities include cardiovascular morbidity and mortality, type 2 diabetes mellitus, certain cancers, dyslipidemia, and obstructive sleep apnea. Obesity reduces health-related quality of life. Moderate weight loss can improve glycemic control and other cardiometabolic risk factors, as well as comorbidities. Liraglutide is an analog of the incretin hormone, which is otherwise known as GLP-1, which stands for glucagon-like peptide. It has 97% of homology to human GLP-1 theoretically and is believed to have dual benefits on body weight and glycemic control. It mediates weight loss in humans mainly by reducing appetite and caloric intake rather than increasing energy expenditure. The field of the methods. I have there listed my objective. It says to investigate the efficacy and safety of 3 milligrams of liraglutide versus a placebo adjunctive to lifestyle modifications for weight management in overweight or obese adults who did not have diabetes at baseline. Okay. As you see, the trial design, it was randomized, it was double-blinded, so the patient didn't know whether or not what was going on exactly, nor did we know as physicians on our hand. So it was completely double-blind. They were going in, neither one of us knowing exactly what was going on. This did take place at 191 different centers in Europe, North America, South America, Asia, Africa, as well as Australia. Duration, it was 56 weeks. The trial began in June 1st, 2011, and it went on through March 18th, 2013. It was a 2-year extension involving pre-diabetic patients, to evaluate whether liraglutide is associated with delayed onset of type 2 diabetes. As you see, it did have, it did have IRB approval. And as far as inclusion, it included those who were 18 years of age and older, who had a BMI of greater than 30, so we did want to tackle our obese patients. Those who had a BMI of greater than 27 or above, we treated those, who were treated or untreated with dyslipidemia or hypertension. So as you see, we have our exclusion down there. You can read that, our subject there. Now, as far as our primary endpoint, 3 co-primary endpoints. We had weight change from baseline, proportion of patients who lost at least 5% of their baseline body weight, and then we also had a proportion of patients who lost more than 10% of their baseline body weight. Secondary endpoint were changes from baseline in BMI, waist circumference, glycemic control variables, as well as health-related quality of life. Just kind of moving along. As you see there, we have a diagram of our arms there. You can see the liraglutide, 3 milligrams. The placebo, on the other hand. So just basically showing you the two different sides. Yeah, those who were on it, those who were given that false pill to make you believe you're on it, so we can actually see the true effect. And again, no one knew it was a double-blinded trial. It says there that starting a dose of 0.6 milligrams and weekly 0.6 milligram increments of 3 milligrams, or the placebo, of course. Both groups received counseling on lifestyle modifications. So we tried to keep, well, basically, I keep saying we, but they tried to keep everything aligned, keep everything the same, so that we could really see the results of the liraglutide. All right, as for the statistical analysis, so 99% power with sample size of the liraglutide and the placebo. We did have the student test as well, logistic regression, subgroup analysis, just kind of reading some of that there for you. And then as far as the results, the characteristics were comparable between both of the groups. Both race and ethnic groups were self-reported, except those from France. Okay, just kind of giving you that time to look over that. All right, so just moving down to our primary endpoints. So what I did was, if you kind of just look at it, I just kind of took the graph from the article and basically just kind of pasted it over here. And just so you can really truly see what took place. And so as you see, we have the liraglutide and it's compared to the placebo. And then we also have the p-value, which lets us know, okay, how true you can really look at this. So you can see now it's less than that 0.5%, 0.05%. So it's really, really good data here. So as far as the percent and weight change, you have that. As you can see, those who were on the liraglutide had better improvements. Really wasn't, I don't want to say it wasn't a good study, but it was more so the benefits were good, but there weren't a lot of benefits, if that makes sense. I just really do, me personally, I really do strongly believe that if the person is taking in those lifestyle modifications and doing the right things as far as taking care of their health, that's going to help improve anything. So as you see here, that body weight there, the change in body weight was fairly similar, not too much, but fairly similar. And then just going down, if you look over there into the glycemic control variables, you can kind of see that once again, very similar, except for, of course, the fasting. As you see, it really had a huge impact on the fasting, which is what, basically what we expected, So a few of the adverse events, they had GI effects. Of course, death is always a risk. Some people discontinued the drug due to those GI effects. So that's something that I do believe that they need to go back in and kind of tweak with the drug. The fact that, okay, yes, the drug is good, but if they're not going to take it and stay compliant with the medication due to the GI effects, then why even put them on a drug, And they also have a few gallbladder-related events, nothing too serious there. So liraglutide was initiated as an adjunct to diet and exercise, as I stated earlier. It was associated with clinically meaningful weight loss in overweight or obese patients. And again, I'll let you remember the article was kind of pointed out to you. They looked at those with the BMI greater than 30 and those with the BMI greater than 27 who had dyslipidemia, another like hypertension, other disease states, comorbidities, I guess I should call it. It was associated with with concurrent reductions in glycemic variables and multiple cardiometabolic risk factors, as well as improvements of health-related quality of life. Some of the strengths, this is just me, my critique. Some of the strengths were, of course, we had a huge sample size. It was huge. I don't know if you remember or not, but we had 191 centers from different parts of the world. Huge sample size. Low attrition rates as compared with other weight loss trials and lifestyle interventions and resultant weight loss. I don't know if you saw, but there were a decrease in the weight loss with both ends, actually, the placebo and with those who were on liraglutide. So sometimes just saying, hey, you guys, we need to figure out what we're going to do. Just kind of counsel these patients on the use of, the appropriate therapy. Weaknesses, there were no corrections for multiple testing performed, and of course the funding of the study provided by the pharmaceutical company. And in conclusion, it says, this study has shown that 3 milligrams of liraglutide administered once daily in overweight patients, as well as those who are obese, who do not have diabetes, result in a clinically significant weight loss and improved secondary endpoints. However, liraglutide is no cure. Most obese participants stayed obese, and the reversal of the metabolic syndrome was not quantified. The liraglutide may be required indefinitely, like statins. However, if delivered by injection, you have that cost there. Fortunately, even modest loss of body weight of 5 to 10% makes medical issues more manageable. Just kind of go back up there as you see, it was showing you that as it pertains to 5% and 10% body weight loss, liraglutide was favored greatly. So overall, it did help with weight loss, which is a good thing. But I don't feel like a lot of people are going to be on liraglutide just because of the expense. There are a lot of cons to it. But if you do have any questions, feel free to email me. My email address is Carla with a C. It's carlamoore@rockymail.com. Anything else, just give me a call if you have any questions. Thank you.